counselor says post-traumatic stress disorder had taken a grip on his life. The Army Green Beret did 6 tours of duty in Iraq. Much of his time on deployment was spent alongside his beloved dog, Mike, a military canine trained to detect IEDs.
He served his country just like a soldier would.
Matt retired from the military in 2012 and adopted Mike. Then just 2 months ago,
he was shot by a gentleman that was on his bicycle.
Mike did not survive, and the profound loss sent Matt into a downward spiral. So touched by his story, former Texas Governor Rick Perry started raising cash to get Matt help at a specialty brain center in Texas that's in dealing with symptoms of PTSD.
What I care about is the result, and I have seen time after time after time young men and women who have come here and left in a better place.
Doctors at Cerebrum Health Center say it's their non-conventional practices that set them apart.
We come together and we create a treatment plan that will help enhance brain function, help reduce pain, help restore normal biomechanics, help activate the brain.
Matt is finishing up his 2nd week here and claims he's never felt better.
I feel stuff going on inside my brain
That you hadn't been feeling.
I haven't felt for 20 years.
Patients pay about $6,000 a week for treatment. The average veteran stays about 2 weeks. Brett?
Great story. Yes, thank you.
Thank you for inviting.
You ever want to call it unconventional therapy? You think like reporters showed up to Henry Ford on horses and looked at a Model T like, yeah, that's an unconventional way to get around. I wonder if that'll ever catch on, right? So Dr. Brock is an awesome speaker, and you guys are about to learn a whole lot, and he's super, super smart. So we're going to kind of link what Dr. Hall talked about with what Dr. Brock's about to talk about. So what's specificity for you guys? What's specificity? What do we talk about in school? Being specific, right? So what do we move when we adjust? Is there moving a bone component? Yeah. Are we changing muscles? Yeah. Are muscles motor and sensory, which we sometimes forget? Yeah. Are we affecting the nervous system? Yes. Are we affecting that from the adjustment peripherally, or are we affecting the adjustment centrally? Yes. Trick question, both, right? So we know from Dr. Hall's talk that a good frontal lobe is great for being healthy, and a good brainstem is being great for healthy. So now we get to talk about how our adjustment gets to help the frontal lobe, and how our adjustment gets to help the brainstem, and how, as chiropractors, what we do is affecting that central part of the nervous system. So I have a question that kind of goes back to, is Dr. Ross still here? Cool. So one thing I learned from him, hanging out with Dr. Jerome Libba in the back too, who's also a very intelligent individual, is when we talk about specificity, does that only apply to a joint? Right? So if we're adjusting somebody and they come in and they're super, let's say they just got fired from their job and they're in a fight with their spouse and their kid just got into a fight at school and they come in and they're telling you all of this and you're like, man, that's too bad. Boom, you adjust them. Do you think that central integration with their emotion and their behavior and what mood they're in is the same exact thing when you adjust them if they're happy versus sad? Just a thought. So when we talk about specificity, it's not all about joint specificity. It's about a lot of different things. It's about what you're looking at, what you're listening to, what Dr. Hall said, previous experiences, and how you're perceiving your modern and future, or present day and future stresses. So it's all of that. If you guys are interested in that, come to Neuro Club. A lot of that stuff we try to hit on weekly. So other than that, thank you so much, Dr. Hall. That was awesome. Now we got Dr. Brock, and that was on Fox News This Week National News. So we've got a chiropractor on national news, and he's super awesome. So without further ado,
Wow, man.
Dr. Brock.
Every time he talks to me, he lies more and more and more.
I get more and more excited.
Yeah, no. Well, it's it's a neuro night, and all of you nerds with Asperger's that have nothing else to do. Yeah. No, listen, man. I gotta tell you, this is really. You get old enough to where you actually have a little bit of experience, and when you get a little bit of experience, you start realizing some things, and that is that continuing to learn,
And being around people that have experience and that can give you something to enrich your life as a clinician is a very special thing. I've got colleagues that are here with me that I learned from, and it's really nice to be able to also be collegial and interdigitate with other practitioners. Thanks, man, for just, hanging out. Let's do this stuff together. I think that we've missed the boat on that, and we won't do that anymore. So getting to teach and share and say, hey, this is what we're doing to change brains. I realize I have to be very careful what I say, because apparently when you do any kind of chiropractic maneuver, you don't actually do anything to the nervous system. That's my facetiousness kicking in there. No, but this is the legal aspect of it. Yeah, you realize something, that we just did research that was, published in a really good journal, and it was original research, and had a huge impact score, and it was about chiropractic conservative-based modalities, receptor-based therapy that help people with mental disorders. And it's probably the most notarized published paper in chiropractic history. It was in the top 5% out of 3 million papers. So I would say that's pretty cool. It's time to open your eyes a little bit and just say, hey, just because you palpate it and feel it stuck doesn't necessarily mean that's where the treatment begins, ends, or needs to even be. So look, what I'm going to do today or tonight is just give you some experience. I'm going to float some cases your way, some information your way. I'm going to give you a model. I made a super arrogant title here. Receptor-based therapy from DD to JB. Those are my initials. I'm sorry. I know that I just committed blasphemy. But what I'm going to tell you is this. The more I learn, the more I go around in this big loop of saying, I got to go learn medicine. You learn medicine, you're like, okay, I got to go learn nutrition. And then you go learn nutrition, and you're like, okay, I got to just go back to chiropractic and realize this. Those guys were right. They were just speaking a language that hadn't really even been explained yet. Do you understand that? I mean, a mental impulse is an action potential. But these guys were fantastic observationalists. They were. They knew how to say this. They had a couple things. I just wrote a little blog on my Facebook, and I said this. Look, don't be scared to not believe everything that somebody says that is supposed to be the best. Don't be scared to make observations and say, these observations, I don't understand. I need to go question these things and figure out what it is. Don't be scared to sit down and constantly look at the literature and make what we do a living and evolving practice and process. Don't be scared to do it. I mean, you guys are the thinkers, or else you wouldn't be here on a Friday night doing what you're doing. You'd be out doing what we did during Parker, which I can't even legally say. And neither can most of you, because that's what y'all usually do too. No, but look, let's talk about it. Now, if I say some things tonight that are a little bit different than what some of your other professors say, it's okay. Guys, it's okay. I have changed so much this last year. Let me tell you. I decided to go back to school, which was, at my age, a very foolish decision, but I did it anyway. And I have to pick a doctoral project leader. And I found this little lady who did all the research on fluoxetine, better known as Prozac. And she is the one that did all the research on the little black box warning label that says if you're a youngster and you take this, you might commit suicide. So I thought, I need a ball buster, a big one, because I'm not the greatest researcher in the world. I'm a clinician. Every single day, you can ask my wonderful wife over here. My wife's like, what are you scared of now? I'm like, her again, man. She's little, about like this big, and every day, the skin on my ass gets a little bit thicker because she chews it and chews it and chews it. But she's forcing me to literally think. Which I reluctantly am doing, but I realize this. Great academic institutions like Duke, the reason why I wanted to go there is because I needed something to take me to a level of understanding I didn't want to go to Vasco da Gama Tech. I don't know if that exists, it's kind of a joke. But I needed someplace that would say, hey, you can either do this or you can't. We're either going to push you and you do what you're going to do, or you're not going to do it at all. So what's going to happen is this. My doctoral project there is going to be taking what I'm talking about now and taking the research that we've done and making it a QI project where it literally gets turned into Congress now. Not state, but up, United States, and it turns into standard of care. Because they will pick 7 people to lock in a room, and they say, don't come out until you guys have it figured out. Rumor has it, somebody might make it in those top 7. Just saying. I don't know, but maybe. Last time that happened, I ended up going to the meeting for 1 day and drank mojitos for 8. Didn't go back. So, hey, look, I like to lecture, I like to talk, I like to teach, I like to talk about diet, I like nutrition, I like neurology. Neurology is my first love. I do love medicine. I like all these things. I like to say, where does what belong where and when? But what I really like is I like to say, not what needs to be treated, but why. I think Dr. Hall talked about that beautifully just a minute ago, and that is, why are we doing what we're doing for what comes in your door? That's the basis of wellness, by the way. Our vitality. So when we do this, we have to realize that the nervous system is contiguous, and this is what I was taught. The nervous system is contiguous, meaning if you change one thing, you change another, and if you change another thing, you change another, and if you change another thing, you change another. If you change the brain, you change autonomics. And if you change autonomics, you change fuel. And if you change fuel, you lose, tissue capacity. And if you lose tissue capacity, then you lose integrity of tissue. You guys see how that goes, right? But it's not just the nervous system that's contiguous. It's that every system is also contiguous with the nervous system. You see, here's the deal. There's been this big debate on, it's so funny because, they're straight and mixers. Well, now there's functional neurologists that also like functional medicine. Those bastards. and I can tell you, here's what I found out. The more we learn and the more we read papers, the lines get blurrier between a functional anything. It's just an integrated practitioner, man. That's what it is. So I'm going to make it my own name. Functional integrated practitioner. And nobody will be happy with it because I said it, right? I was telling somebody the other day, everybody wants to name stuff after themselves. I got the wonderful, wonderful gift of doing this. I have a lot of Hashimoto patients, and girls, their hair falls out. It's a sucky thing, man. So I called my buddy, my best friend is a compounding pharmacist, and I said, I want you to make this stuff for me. So he made it. And anyway, he ended up getting it, and I called the pharmacy. I said, I need some of this stuff. They go, what do you mean some stuff? Like, you don't call a pharmacy and say that, okay? I go, the hair stuff. It wasn't the person that helped me formulate it. And they go, what are you talking about? I go, the hair cream that y'all just made. They go, oh, Brock's hair gel. I go, Brock's hair gel? They don't name it that? They're like, oh yeah, we had to name it something. And I'm like, I'm bald. And I have hair gel named after myself. And I'm a chiropractor. It doesn't get any more ironic than what just happened. So, anyway, I realized this, man. Things happen, things change. You will end up in places you never dreamed. But if you give 110%, and I mean this is what I tell my kids every morning. If you give 110%, and you refuse to accept the limitations that other people put on you, and trust me, I have had people try to put limitations around me beyond your comprehension in the last couple of years. You just walk through them, and you keep going, and you keep doing what you're called to do. I don't care what you call your calling. Some people call it God, some people call it a higher power, some people call it their inner self. You walk, and you keep going, and you keep going, and you keep going, and you pull. If your thing is pulling papers and integrating care, or doing what you do, you keep going, and you give 110 freaking percent. Until the story grows and people get better. Because at the end of the day, when it's all said and done, you're only going to be able to look back, and the things you're going to remember is what you did for other people. You're not going to remember really what cool thing happened to you. like being on Fox News. It was cool. It'll probably never happen again. But I'm going to remember the 2 girls I saw today. I'm going to remember the 3 kids with pandas that I helped. I'm going to remember the fact that I sat down and I learned a little bit more, and that little bit more learning got me much, much better so that I can help a whole other group. Those are the things that you're actually going to be able to look back on. Your hippocampus is still going to hold on to it, and so is your frontal lobe and temporal lobe. And you're going to be able to say this: that's why I lived on this earth. You're here. It's Neuro night. It's Friday. It's dark. The wild turkey's right there calling your name. And the other places around the corner. I went to school here. So listen, man, I used to say, okay, I love receptor-based activation. I mean, that's the closest thing I can call chiropractic care because, okay, is it just upper cervical? I don't know. Is it Thompson? I don't know. Is it smelling flowers? I don't know. Is it being happy that you're going to your kid's basketball game? I don't know. It's environmental enrichment. It's the way you choose as the professional to say, how am I going to stimulate this person to where they're now a different creature, have a different genome, have a better response, and now interact with their surroundings in a way that they just feel better. Okay, that's kind of what health is. And then I realized, wow, man, I love this vestibular system because it's the firing pin for the entire system. I mean, your vestibular system is what fires into your limbic cortex, it fires into your frontal system, it fires into your temporal system, and all of our receptor modalities fire into the vestibular system. So if I'm moving your body in a certain direction, if I am giving you joint activation, if I'm giving you soft tissue activation, if I'm giving you ocular activation, it all fires into that vestibular system. So then we have to start asking these questions. Listen, when we fire these receptors, they go to the brain. And trust me, I'm literally not kidding you. If there's a day where Dr. Brock never shows up again because he started his car and it goes and blows up, it is because the Texas Medical Association and all of their illustrious attorneys have heard me over and over and over again say this, and they can't debunk it. What we do changes more than just a segment. Do not make what we do as impotent as that. Do you catch that? This should liberate you just a little bit. And it's not that there is not subluxation or that I don't believe in subluxation, because I do believe in those things. But what I'm saying is those subluxations are a window of dystonic components of higher centers. So when you think about that, what are we really impacting? That is the point of today. What are we really impacting? Do I know everything for a fact? I'm going to tell you no. There is hypothetical, and you guys understand that. That's something that's not quite proven, but it's a pretty good hunch. And then there's theoretical, which means there's literature behind it. And then there's things that have been theoretically proven and have been, put into clinical practice, and that is called the standard of care. Okay, evidence-based is the end line. You know what's really interesting? I know the couple from Harvard that made up the term evidence-based. I know that it has been taken so out of context. They'll sit there and they'll tell you, insurance shanghaied this term, and it's not even what we meant it to be. It was used as a way to allow for quality improvement to enrich services, not as a way to delete 95% of the things that we know works. And it's not even meant to be used as a way to delete things that clinicians observe that's not necessarily always proven. It's been taken out of context. So, let's go beyond the third parties. Let's go beyond the classroom. Let's go beyond the windows. Let's go beyond 35. Let's step into the clinic and let's talk about this. The real patient that walks in and says, I want to die. You're the last person on earth I'm going to talk to about this because I've already talked to too many people. I have no money left. I've gotten rid of all my possessions. This is literally a conversation I had today. If you don't do something, I am literally done. A couple more hairs fall out. Where's the Brock's hair gel right now? But then you realize, this is why you went 110%. This is why you went 10 steps further. This is why you read 10 more journals. This is why you did this. This is why you did that. This is why you have been called to be a healer. You understand? not to be this mega, I'm going to, join this thing and, get 9,000 patients. You're being called right now as somebody that's really learning the nervous system to take cases that people don't really succeed at and do something with them because they don't have hope. So I realized that I had to get good at vestibular therapy. And so I learned. And then I realized, hey, can I use olfaction? Well, I can. I can also say this. Almost every neurodegenerative disease starts out with this. You lose olfaction. It deteriorates first. You actually have an olfactory barrier. So when I'm walking down LA street and I smell something terrible, I'm like, thank God. Yes, it's crap. I can still smell. And we also know this. Your gut function changes. The enteric nervous system. All of the nervous system that is out near those areas that become inflamed and have less protective boundaries and borders, they get beat. They don't have good descending regulation. So now one has to start to ask the question, and I'll parlay off what Dr. Hall said, is that when you see autonomics that are out of control, and you see posture that is out of control, and you see pain that is changing, and you see gastrointestinal function that is not the right thing, and you see the immune system that's not right, and you know their detoxification sucks, you've got to start saying, who is the boss of the bosses? This guy. When your brain starts to suck, and your vagal, and your autonomic, and your neurological tone, that vagus goes down and it gives you stomach acid. It gives you digestive enzymes. It gives you peristalsis. It shunts blood to the wall of the lining of your gut so that you don't get a leaky gut. It can happen other ways. You can get infection, you can get SIBO, but the brain's involved in that too. It goes down to the P450 system and keeps it from genetically mutating and epigenetically changing, so now you biotransform things correctly in phase 1 detoxification. It goes down to the spleen and it activates cytokines so that you have an immune system so that you don't become sick and get infections and become very, very compromised. And now you become so ill that the brain has created an infection, the infection has sustained inflammation, the inflammation is now out of control, the barrier systems have now broken down, and the infection has come back home to the brain, and now you have a brain infectious, inflammatory brain loop. There's about 128 of these loops we put together. So I'm a loop breaker. That's what I do all day. I try to say this. I'm a chiropractor. I like nutrition. I understand some medicine. I love biomechanics. I like to read labs because labs give me insight into which of these loops are involved. And then I like to get to know the patients so that I can say, where are you at? What are you thinking? What are you doing? What have you been through? Have a great case today. A girl was leaving to go back to Australia. She came to see us. Her balance improved by about 75%. Her verbal and visual memory on impact went up 50% in 1 week of care. She's fixing to leave, and I look at her ASI, her adrenal stress index study, and I notice that right about 8 o'clock, her cortisol goes almost up to 20. In other words, it's 4 times higher than her morning cortisol release. I go, hey, why? What's going on with you at 8 o'clock? Just tell me, what's he doing? She goes, he beats me. I go, he beats you every night at 8 o'clock, doesn't he? She goes, yes. I go, you came here and you're well. I don't know why you got better. Maybe I spun you the right way. Maybe we did therapy the right way. Or maybe you just got the hell away from your husband. I want you to hear this for a second. I said, hey, what are you going to do about this? Because look, you flew here. You paid to be here. This is a $20,000 trip for you. If you walk back into this, what are you going to do? She goes, I've been thinking about it all week. I go, why didn't you tell me? She goes, because it's embarrassing. I go, you're right, it is embarrassing. But guess what? I'm a healthcare practitioner. And I treat brains. And guess what? This is total neurological. This lives in your head. She took a big deep breath. She goes, I'm leaving. And I'm going to be happy. And I'm going to heal. And the presence in the room, I don't know how to explain some of these things to you. The presence in the room changed. It was not an encouragement to break a relationship apart. It was, here's evidence that you're sick because you're emotionally ill because somebody has come into your life and has broken you. I would have never expected it, and neither would had she expected me to ever say that. One lab test, one stress test, looking at one stress hormone, and that one stress hormone, let me tell you what it does to the brain. It parts your hippocampus. So you lose memory. She lost it. She got it back while she was there. It disconnects your frontal system from your subcortical system, so now you don't have regulation over your own emotions and control. It blocks the function of serotonin. So now the ability to be happy, the ability to turn that volume knob up on all the things that are awesome in life gets turned down. So she walked in as a shell of a human that didn't give a crap if she really lived or died. And the only reason why she was there was because her friend made her get her ass on the plane and fly here. Australia. It doesn't get any further away. And she goes, "What can I do for you?" I said, "Stay better. That's all I want. Don't come back because you're better and you don't need to." It happened because we did this. We became a functional everything. I hate to say it. We have finally had to embrace the fact that we have to become a jack of many trades. That's why what you're doing right now is the hardest position in healthcare. I want to say it again. That should make you excited. It should scare the pee out of you a little bit too. The rabbit hole never ends. You keep looking and you find more. You keep looking, you find more. You keep looking, you find more. You keep looking, you find more. I had a company came in today called Moleculara, and they are the leading immunology people that look at PANS, PATANs, PANDAS, all of these neuropsychiatric diseases because kids get strep, and it molecularly mimics a part of their neurological tissue, and as a result, they just go bananas. We're going to become their main clinical spot. You know why? Because we're the only people that know how to take a positive test and do something with it. Everybody else is like, it's positive. Go see somebody else. And they go see somebody else, and they're like, I don't know what the hell to do with this. You go see this guy. And they all end up at Stanford, and they get plasma exchange. But nobody took away their food allergies that have ramped everything up. Nobody's activated their brain. Nobody's checked their frontal lobe. Nobody's removed any subluxations. Nobody's looked for the infectious disease to see if it's still there. Nobody's done anything. Do you realize that? It's a 30-move system, and nobody's done anything. But they own it. And so they finally said, screw it, man. We want you guys to do it because you're integrated. You're not multidisciplinary. You're integrated. In other words, you know about a lot of stuff. So that's where we're going. I know I'm bloviating. Oxygen. I used to always wonder, why did my emphysema patients not recover as well? What about my COPD patients? What about my SpO2 patients? What about my patients that smoke? What about my patients that are anemic? Does it matter to brain? Does it matter if my MCV is scooting up a little bit? Does it matter if my ferritin level is scooting down a little bit? Does any of it matter to somebody who needs a better brain so they have better descending regulatory systems to their reticular system? They have better curves. They have better joint integrity. They know where they're at in space and time. They're happier. Yeah. I realized this. I had to learn about it because guess what? About 10% of our patients have anemia. And it can be very cut and dry like iron. But guess what? If you give iron at the wrong time, it becomes a Fenton response. So they get more inflamed, and then you break down the blood-brain barrier, and now they get autoimmune disease in their head because you gave them the wrong nutrient. Not wrong drug, wrong nutrient. You mean nutrition can be dangerous? Well, yeah. You guys, drugs alter physiology by 90% or more, or else it can't be a drug. Herbs and other things, 30% to 55%. There's a lower side effect yield. So then I said, man, what about glucose and insulin? Do I got to learn about that crap? Because after all, in the Neuro program, we do have a whole module called Neuron Theory. And I realized this. 48% of our patients had blood sugar problems. So If you have no insulin, insulin docks right on. Brain. If you have really bad blood sugar dysregulation and we try to create plasticity, it is definitely the piss in the wind effect. It just blows right back. It's pointless. It doesn't work. We found the same thing with growth hormone. And then we did all these research with all these meds, and we found this. People who are on high-dose opioids, they don't get better with their balance. They don't. So we have to say this now. Hey, I know you're hurting. I know you have, you got to take OxyContin and all these things, but guess what? Your balance is probably not going to get a whole lot better while you're still on this medication, because it does this. Muscle relaxers and narcotics shut down the velocity storage center so we can't get the VOR to perseverate, so you can't recover from perturbations. Now, what does that mean to you as a chiropractor? Everything. If you're into brains. Okay. So then I had to think about digestion. Well, what about digestion? Well, can you actually digest nutrients? I mean, think about it. If you have SIBO, small intestinal bacterial overgrowth, all that bacteria, it eats the protein. Bye-bye muscles. It makes it to where you have malabsorption of fat. So see you later, fat-soluble vitamins. It makes it to where you produce methane. Hello, constipation. It makes it to where you produce lipocholic acid, which breaks right through the barrier, and it allows all these inflammatory peptides, all these foods to come in that activates an inflammatory response. And now you have a systemic alarm reaction, and the immune system starts to get confused between the bad guy and self, because these are undigested peptides that look like other things. So there is a mimicry response to an epitope. That means there is a lot of similarities between you two. There's 2 arms, there's 2 legs. Obviously, you are much better looking than you are. But if I'm an immune system cell, I can't afford to say, look, I don't know the difference, I'm just going to attack both of you. So I start to make polyclonal expansion, and now I start attacking self and non-self. So I'm thinking, crud, wait a minute. I've got to learn about digestion, and digestion can deal with inflammation, and that can damage brain. And then when I damage brain, I can actually infect the vagal system or actually damage the brainstem system that has vagal output, which then goes back and deals with gut tone. Now I've got a gut-brain-brain-gut axis. Oh. And then that person gets a concussion. And 6 months later, everybody's like, why did this person who barely got hit still have a concussion? And you go through it and they have Hashimoto's, so their basal metabolic rate is down and they can't heal. And they have autoimmunity, which means they have antibodies to one tissue, which means they have antibodies to other tissues, which means these circulating cytokines, including TNF-alpha and interleukin-6, have broken through the blood-brain barrier, and they sensitize the microglial system, and the microglial system says this: we're just going to stay on, guys, and we're going to make so much inflammation, you're never going to heal. And you start looking at it, and you're like, whoa, wait a minute. You mean I got to start looking at thyroid function and gut function and blood sugar function and oxygen delivery and a head injury? Well, if you don't, here's what happens. You activate their brain, they do a little bit better, they leave, they call you 2 weeks later, they're like, it's back. You're like, crap, what happened? 2 years of literal butt whippings. And just saying this, I have to learn more. And what we found is this: the whole thing is contiguous. Just when you thought you could leave that one system out, it shows up and you have to know it. So listen, why do we really differ from, let me just call it Western medicine? Western medicine is this: hey, you're going to go do your general internship and you're going to know a little bit about a lot of things, but then you're going to specialize into being a plastic surgeon to left eyelids only. In other words, it becomes more and more and more and more myopic. It's not training doctors like they used to be, to where they said this: whatever you got, I'm going to fix it because I am a clinician. Sorry, but that's where you got to go. I don't know what to tell you. You can live under chiropractic philosophy and say this:
I'm going to remove nerve interference and everything's going to heal. That may or may not be true. I can tell you time and time again where that hasn't been true. You can live by a lot of different philosophies, but if anybody tells you that one thing fixes everything, you run from them every time. And you go sit down and you start learning and integrating. So this was my attempt to say, look, what are some of the things that I have to look at on every patient? Do I have to look at mitochondrial function? I've got to look at ATP production and what can stop it. Okay? I've got to look at the ability to, if I don't have ADP and P come together, what happens? I phosphorylate membranes, they get fragile, cells break. Mitochondria shuts down, so the cell gets closer to the threshold, so I have seizures, I have migraines. My autonomic nervous system, it changes. Literally, your system starts to die, but it becomes edgy and it fires spontaneously. We used to call this transneural degeneration. We're starting to understand a whole lot more about this. It's excitotoxicity. So now you're like, wow, what happens when NMDA receptors get an antibody to it? Or D1 receptors get an antibody to it? Or what happens to this? What happens when you get an antibody to your drug and you're taking it? And your immune system reacts to it, and then you have cross expansion over to your cerebellum, and now you're ataxic. Why is it that 50% of our thyroid patients end up with cerebellar antibodies? And why is it that those people that if we don't control their immune system, their cerebellar system doesn't get better, so they have proprioceptive abnormality and they get spinal damage, knee damage, ankle damage, upper extremity damage, shoulder damage, damaged AC joint, torn rotator cuff, whatever the case may be? Why? Well, now I got to learn about autoimmunity. And you're like, ah, cool, let's learn. That's what you see. You say, great, give me the damn paper, let's go. You just do it. So this is kind of just me sitting down one day and saying, you know what, let's throw it down there. I love looking at B vitamins. B vitamins are part of everything. You know how many people are running around with hypochlorhydria? Dr. Hall was right. You don't overproduce acid, you underproduce acid. Food goes down there, it rancidifies, and you get hyperreflux. All of these sphincter regions stop to function. When brain goes down, pretty much let's just say this, everything kind of starts to suck. You end up not having good gut function, you make tons of gas, the gas pushes open the ileocecal valve. Let me tell you something, you AK guys, you're right. You muscle test ICVs all the time. What happens? Every time they come in, you're like, your ileocecal valve's open again. What the hell? And then you ask them, here's a simple question for you. Every time you eat starches and sugars, does your belly extend? They're like, yes, like a basketball. Guys, they have small intestinal bacterial overgrowth. Every time they eat that stuff, they make hydrogen and methane that pushes all the sphincters open. And all the guys that live in the large intestine, they come into the small intestine like this, and they're like, we're just going to live here. So now, no offense, but your intestines become Oak Cliff, not Highland Park. I did that for Jerome. Jerome, the South African. Jerome's actually from South Africa, and his name is Jerome. Look at him. And he lives in Oak Cliff. Jerome, I love you, buddy.
Bishop Arts, bro.
Oh, that's right. Bishop Arts. Guys, we brag on each other all day. That's the thing that keeps us safe. Autonomic regulation, hormones. Oh my gosh. So then I have a lady that comes in and she becomes, by the way, what is the average age, do you think, of dementia in our clinic? What do you think? She says 50. What do you think? The average age of dementia, like to the point where you're on an MMSE, you're around a 15. It only scores to 30. 51. I love it. I have people come in all the time, and I love it whenever I take them in. I'm like, don't say anything, just watch this exam. And we start talking, and they're doing pretty good. And I'm like, hey, what's the date? And they're like, I'm like, what year is it? She starts to cry. And then I look over at the practitioner, and he goes, I'm like, 51. Doesn't know the year. I mean, we all know it's 2014. So come on, man, look. I look at this person and she had gone into menopause. and she had no adrenal function. Do you know what takes over for estrogen when you go into menopause? Her FSH was sky high. You had no estrogen. Her adrenal system, your adrenals kick in. If your adrenals are not there because you were the CEO of a business for 38 years and you were up all night every day and you burned those suckers plumb out, she became demented in 3 weeks. 3 weeks. Picture this. You know the Star Trek Enterprise? How it always has that force field and like nothing can really penetrate it? And then whenever it goes down, everybody like gets blown up and they all should die, but they really don't. That's what estrogen is for your brain. I've never seen anything like a woman deteriorate with no estrogen, postmenopausal, and no adrenal backup. It is fantastically scary. It's brain though. And what happens when the brain starts to deteriorate? We are the only people in the world that activate it with novel capacity that is specific and that does it in a way where I can say this. There's 5 things keeping me from making plasticity. I'm going to get rid of them, and I'm going to make plasticity that's specific, and it's going to stay, and that person's going to get better. Why? Because we'll find some estrogen. We'll take it from Jerome. Just like, suck it out like a turkey baster. Sorry, Jerome. Jerome's my boss, man. I better watch out, huh, Jerome? No, but we realized real quick, okay, so look, we got to do something with the adrenals, we got to do something with estrogen, we've got to protect the brain, and then we got to activate it, because if we don't, we're activating a system that's not going to respond. All right? So if you're adjusting that person, are you adjusting it for a sheer monodisynaptic reflex that might inhibit pain or spasm? Or are you trying to get to higher centers to make a difference? What are you trying to attempt with chiropractic care? That's my question. And that's your patient's question too. I mean, if that patient comes into you with dementia, their back's going to hurt, probably, because we know this, all your postural mechanisms are controlled by suprasegmental centers. And when your brain starts to shut down and your frontal system starts to shut down, you will either perceive yourself falling backwards or forwards, so the anterior posterior musculature will turn on, and now you'll either pull a hamstring every time you run, or you'll start to get camptocormic and sway forward like this. And when that happens, your mesencephalon changes, you have no more dopamine going to your frontal lobe, and your frontal lobe just says, later. You ever seen an Alzheimer brain? The front looks all like super small noodly, while the back is now big and noodly. Large amount of anterior projections from that ventral, rostral, reticular activating system. So listen, I do want to say this. Here's the beautiful part about neurology when you learn it at this phase. You don't really know everything, which is great, but now when you take your neuroanatomy class, you start looking at it and you start realizing this. This is not just an exercise in memorizing slides and stuff. You can start seeing a patient and function jump off the page if you learn it early enough. And see, people have they've been critical of either me or other different types of philosophy because they're like, why do you want these people to get involved so early? They don't know anything. I'm like, well, yeah, here's the deal though. It teaches them a concept that when they go through chiropractic college, now the concept applies, and it's not just a bunch of malarkey trying to get to the end, you get to student clinic and get your hours and get the hell out of here. Do you understand the difference? Now when you take biochem, it applies. Now when you take neuroanatomy, it applies. And you're sitting there and you're like this. Now my classes are making me who I want to be. They're not just a pain in my butt. That's where medicine does have us. Medicine knows this. I better learn my biochem or I'm not going to pass pharmacology, and if I don't pass pharmacology, I'm going to fail my boards. Good night, my friend. Don't let the ghost get you on the way out, okay?
You guys take care.
So look, what a great time to learn. Let's go to the next slide. Well, what happens when you do an adjustment? I mean, I'm going to get to the cellular level, and then I'm going to get to the brain. I'm going to break down each portion of the brain. I'm going to say this. Based upon the literature, this is what happens. And we've got just enough time to do it. And then after that, I'm probably going to go smoke a cigar because I like to challenge my brain so that I can keep it in shape. What's that? Well, if you have Parkinson's, like in my family, it's, nicotine is, anti-Parkinson, really. So. We're good to go. So listen, guys, when you do an adjustment or you do any receptor-based activation, the action potential has to carry from the receptor to the first order, to the second order, to the third order neuron. Now, this is a picture that I made, and this is now in a chapter. This is from a paper that was published by me and Dr. Karazian. You guys know who here knows Dr. Karazian? Dr. Karazian and I, we're starting a functional neurology program this year that will have everything interdigitated. This is now going to be a chapter in a book on traumatic brain injury. 42 pages. That was a fun journey. So I'm sitting around one day and I'm like, what happens inside of a cell? So I started kind of thinking a little bit, and I kind of pulled this up in front of my head, and Visio on a computer, you can make this very quickly. What happens is, when I activate a receptor, and it's traveling down that axon and it hits that first order neuron, it activates these AMPA receptors. And I look at AMPA receptors as little groupies around the big rock star, which is called an NMDA receptor. And the AMPA receptor just fires and it takes the action potential to the next order neuron. But while it's doing that, it says, hey, NMDA receptor, do me a favor. Take the magnesium off of you and let the calcium come in. And it says, sure, no problem. So the calcium comes in. And what happens is, this is what happens when it goes bad. I'm going to tell you that in a second. Let me just tell you the story. Calcium comes in, it activates the mitochondria for energy, it activates the nucleus for protein replication, it stops oxidative stress, and it activates the next order neuron, which makes brain-derived neurotropic factor. It comes back, and then it strengthens the signal, and you create plasticity. Did y'all catch what I just said? You guys realize that early chiropractic facilities had nothing to do with segments. They had to do with people who were mentally ill. You know why? There were no psychiatric drugs. There was no Haldol. There was no Thorazine. They were adjusting people because they literally didn't have anything else. And you know what was happening? 82% of our PTSD patients changed a whole category in severity. 82%. And that was with this. We were so stupid, we didn't even have any exclusion criteria. We had people rolling in. I swear, I'd come in, I'm like, who's the homeless guy in here? They're like, that's a vet. I'm like, and they're like, yeah, he hasn't left his house in a month. A month! The dude has a job now and wears a shirt and a tie and is in good shape. I'm like, what happened to you? He goes, what do you mean what happened to me? You guys happened to me. I have to remind myself every day, I literally can't believe I just saw what I just saw. Now, when you become inflamed, or you become deafferentated, or you get fixated, or you have bad hormones, or you have low neurotransmitters, or your blood sugar becomes aberrant, or anything that is not healthy starts to occur, these NMDA receptors develop the probability of getting leaky, and they let calcium in. Now, you're like, Dr. Brock, calcium should be in there. I'm like, you're right, it should be in there. But now, the endoplasmic reticulum drops calcium. Now, these AMPA receptors start to drop calcium. Now, the voltage-gated calcium channels start to drop more calcium. Now, you got so much freaking calcium in the cell that everything reverses, and now you do not rephosphorylate. And now you make something called peroxynitration. In other words, the cell blows up. Or it does this. You lower your energy capacity, and what happens is the nucleus, it deletes or duplicates a gene. And now you start to replicate that, and now you epigenetically express a genetic disease. Oh, snap. You mean you actually went there? I'm like, oh yeah, and I didn't just go there, I'll support it with the literature. No activation, epigenetic activation of problems that might be hanging out. We've all got them. You got stuff hanging out in your genome, so do you. So do you. Jerome, he definitely does. I'm going to be fired. So look, whenever this happens, guys, cells start to not make it. Plasticity goes away. It can happen in the frontal lobe. It can happen in the temporal lobe. It can happen in the peripheral nervous system. What I'm telling you is this. We are this, receptor-based practitioners that are masters of the neurological universe. And when I say that in front of attorneys of other groups, they think I'm pretending to be He-Man. Literally, that's what we are. Now, when I say I'm a chiropractor, I'm not just saying I'm adjusting bones, man. Hey, nutrients hit receptors. Exercise hits receptors. Thought hits receptors. Whole body rotational off-axis capacity hits receptors. In other words, I'm driving a system for a certain reason to shape it and to mold it based upon my art. I am this. I'm an artist. I sculpt brains. And the first 6,000 or 7,000 of them I sculpted looked bad. But I've learned how to sculpt one and it looks beautiful now. It's not an arrogant thing to say that. I worked my A off to do that with great colleagues and people who push me every day. And we say this, I'm going to get rid of everything that can get in my way of sculpting that brain. If it's falling estrogen, we're going to fix it. If it's the fact that you have no adrenal capacity, we're going to fix it. If it's the fact that you have Epstein-Barr virus that's in stage 5 and is punching holes in your thyroid to the point to where your TSH is 115, we're going to fix it. I treat a lot of chiropractic families because I have one night a week I do family medicine. Okay? It's just like a true family medicine. Like I got a doctor, I got a sore throat. And I do that because, you know what? How many of you have a family doctor? Okay, exactly. One. And I think I may be some of y'all's family. Yeah, here's the deal. You get sick. So, this girl, she comes in, she's a chiropractor. She has her daughter there, who's, I think she's 5 or 6. And she doesn't talk, she's nonverbal, she's mentally retarded. I do her TSH. Her TSH is 760 something. Let me just translate. She doesn't have a thyroid. And by the way, they test for that in the PKU when you're born. She elected to not have the PKU because she thought, in her chiropractic paranoid ways, that they were going to send us off to some database in Virginia, and now you were going to be DNA printed and identified and followed for the rest of your life. Hell, I don't even know. The bottom line is, fine, follow me. You're going to be bored. You're not going to be able to keep up, first of all, probably. Second of all, you're going to be like, what in the hell is this guy doing all day, driving from here to there, to here to there, to here to there, to here to there? But in the meantime, the kid had no thyroid, which means there was 0 brain development. You can activate that brain all day. Zilch, 0. We give that kid thyroid hormones. Within 8 months, they had hit every level of development. And when we did brain activation on them, you know what happened? It ramped up the process probably 100%. Wow. So I'm like, that's cool. We changed plasticity. We stopped the nucleus from not forming. We increased the basal metabolic rate. Every cell in your body has a thyroid receptor on it. Every cell. All of them. Anybody here have hypothyroidism and want to admit it? Okay. Well, for those of you that do, that aren't going to tell me, you know when you don't take your medication, you feel like butt. You're like this. I'm going to fall. And so I'm like this, hey, this stuff matters. So when there is a problem here, can I use some magnesium to stop the excitotoxicity? I certainly can. It's a great drug. It was the drug until anti-seizure medications came along. Did you know that this is excitotoxicity? Do you know what docks on that? Glutamate, MSG, aspartate, artificial sweeteners. They kick your ass. They cause excitotoxicity. They make cells blow up. They destroy your nervous system. When glutamate spills, you become inflamed. Astrocytes, they start releasing potassium. You want to hurt a nerve? Put potassium around it. Everything starts to fall apart. Everything starts to fall apart. So now you're like, wow, man, maybe magnesium goes a long way. Maybe some alpha-lipoic acid can help. It does the same thing. Why would Dr. Brock infuse alpha-lipoic acid in that head injury patient? Well, because they're so excitotoxic, they're now having seizures. And then whenever they get glutathione and alpha-lipoic acid, Glutathione keeps complexes 1 and 2 in the mitochondria from falling apart, so now they have energy. So I gave them energy. I shut down the excitotoxicity so that whenever I move my finger in front of their face, they don't go, and they have a seizure. Ask an eclamptic female that's pregnant, what are they going to give her? They give magnesium because they can't give seizure medications. So, anybody familiar with the drugs that we've spent about $6 trillion on developing for dementia, and we've got like 4 of them? Namenda. Well, it's magnesium with a carrier molecule on it. Woohoo! What I'm telling you is this. Nutrition matters when I have an excitotoxic patient. When I have an excitotoxic patient, if I adjust the crap out of them, it's going to exceed their metabolic rate, and they don't like it. They don't feel good. They don't like the way they feel after. They feel hungover. Or a whole part of their brain will fail, and it looks like a stroke. Ooh, that's a toughie. So how do I know when they have this metabolic failure? You learn to look at them. You learn to examine them. You learn to interact with them. You learn to look at diagnostics. You learn to look at labs. Some people say they don't like labs. Well, I can tell you this. A lot of people that don't like labs, they don't do labs, so they don't understand what's on there that can be used. We've got lab software that is so amazing. I can't wait to do labs just to put it in there because I like to go up and see if I can figure it out, and then it will show you the percentage of the systems that are broken down, and I'm like, am I right? And then I'm like, yeah! First couple times I was wrong, and I was like, damn. Okay, so we want to keep the cell going. So with adjustments, with activation, with the appropriate nutrition, with the appropriate diet, with the appropriate whatever, we do what Dr. Hall was talking about a minute ago, and that is we put them in an environment that is actually beneficial for them. And what is that? I don't know, man. You got to get to know your patients well enough. The best I'm going to tell you, the most successful chiropractors are not the ones that graduated valedictorian. They're the ones that do this. They know how to interact with a patient and figure out what it is that makes that person sick and tick, and by golly, get better. That is the one. The patient immediately mends to them, and when that happens, the healing begins, and I'm going to say it, from an energy level. Yep, Dr. Brock said it. From an energy level. I have zero problem saying that when I walk into the exam room, I will feel almost every emotion from the patient. Say whatever you want. So we do this, and I say this. I'm a receptor-based practitioner. I make the cell better so that that cell can make systems better. And when systems are better, they become contiguous. And when they become contiguous and they work together, we have this. We have a lack of dis-ease. TD was right. That crazy son of a gun was right. I gotta say it, man. 100 years ago, they made observations that were striking. They were bizarre folks. But a lot of people would say that about me. It doesn't mean that somebody's wrong. In fact, some of those people can be right more often than they're wrong. Maybe not. But we know this, the plasticity of the nervous system. And here's that cell. And by the way, these are the little actin and myosin filaments that are in there. And by the way, we know when things like pandas are hyperkinetic disorders from autoimmunity, you develop antibodies against those structures, CAM kinase, alpha-beta tubulin. We went over it today with an immunologist from the University of Oklahoma. He came to our office. Here's what he said. Why is it that out of everybody in the country, your positive rates are over 90% and nobody else has over 50? I go, because we can identify neurological problems. And they're like, we don't know. You tell us. How are you doing it? I'm like, no, I'm not telling you. That'll be $1 million. It's real simple, man. We have a hyperkinetic intake form. Anybody that's hyperkinetic and we have it broken down, we can tell you which antibodies are going to be positive now. It's really cool. But when the structure breaks down, the cell doesn't do well. When you get tangles inside the cell, it doesn't do well. It's called Alzheimer's disease. Whenever you start to accumulate alpha-synuclein, it makes a Lewy body. That's called Parkinson's disease. When you get other tauopathies, that's called multiple systems atrophy. That's another demented disease. Here's the question, guys. Do you know what cleans all this crap out of these cells? Movement of the cerebrospinal fluid. And a process called autophagy. So we do upper cervical manipulation and we fast them and give them resveratrol. And guess what it does? It rips all the dead stuff out of the cell so it can heal. Because as soon as CSF starts moving, it gets all the crap out that we pull out by fasting. Right out of the literature. I'm sitting in my office one day, I'm walking down the hallway, and I bumped into Ben Carson. The next day, I'm walking down the hallway, I bump into the guy that made Wellbutrin. I'm walking down the hallway another day, I bump into a guy, I'm like, who are you? He goes, I'm Dr. Harshfield, I'm a radiologist, I need to talk to you. I go, okay. I sat down, I talked to him, he's like one of the chiefs of molecular medicine in the whole world. The guy does stem cells, he's teaching me all kinds of cool things. He goes, but what I really want to show you is this thing I do. I'm a radiologist, I look at CSF flow studies, and he showed me how CSF flow would start to move based upon upper cervical manipulation. I was like, okay, cool. He goes, yeah, but this is what cleans out all the debris and dying cells. I'm like, and I looked it up and I'm like, wait a minute, peanut butter just met chocolate again. Again. I was like, you gotta be kidding me, man! $2 trillion? So I talked to Dan Murphy. He's like, yeah, this helps with ATP production. I talked to Maroon and Blaylock, the guys who started excitotoxicity, they're neurosurgeons. They tell me the other story. And then you talk to other people. And so now we got the whole damn story. We put it together and we're like, yeah, I think we can cure or help. No, oh, shit. We help Alzheimer's disease. Now, listen, I've got 10 people in a beta study right now. Their MMSE went from 15 to 25, and we have kept them there for 6 months. Now, okay, is it real or is it Memorex? I don't know. But let me tell you something. Within 6 months, they should have declined at least 2 points on that MMSE. So, somebody's got to do something. If you look at the rate of incline of Alzheimer's disease and the rate of incline of autism, in 100 years, there's not going to be anybody in the middle. Everybody will be autistic and have Alzheimer's disease. What are you going to do? Seriously. Maybe then everybody will get better because we won't create anything else that will destroy the world. I know you're not allowed to smoke weed in Parker, but this is the time where you take a hit off your doobie and pass it to your neighbor. It gets a little deep. But look at this. Exam, intake, forms, labs, whatever it is you're into, we've got to have fuel systems, right? We've got to have good blood flow. We've got to have oxygen. You have to be able to breathe. You can't be anemic. All right? And then adjustment, exercise, soft tissue modalities, nutrition, diet, lifestyle, exercise. All of these things, along with receptors, from joint mechanoreceptors, muscle spindles, soft tissue, vision, hearing, vestibular system. Whoa, here it is, ready? Here it goes. And here comes the activation. And then, as a result, we have a process that occurs. And this process involves the PowerPoint not working. Just whenever it was going to be really cool. Now, but what happens is it allows mitochondria to make energy, and now we end up getting the production of, you guessed it, ATP. The cell can now live. The ATP, the mitochondria is the moneymaker of the cell. Okay? Well, now we activate the nucleus. But before we do that, the mitochondria does this. It gives you energy for pumps, so now sodium doesn't get trapped in the cell. What happens when sodium gets trapped inside the cell? The cell gets closer and closer and closer to the threshold, so it spontaneously fires. Now you go eat the Chinese food buffet with a Diet Coke, and you exceed your metabolic rate, and boom, cell goes, see you later. Or whammo, you have a seizure. Or you're like, why did I eat that food? Now I have a migraine, and I don't even know where I'm at. Do you know how many vets came in like that? All of them. They would walk in, and the first thing they would do, they have what we call the vet stare. They're like this. They don't even know what they're doing, why they're there, or what's going on. I'm serious. Like, it is completely disorientation. You get surface receptors damaged. You start an inflammatory cascade. You activate caspases. And here's what caspases are when you break down mitochondrial complexes 1 and 2. This is why cell biology matters. What is between complex 1 and 2? Something called cytochrome C. Cytochrome C spills out. When the energy level is low, it binds with caspase 6 that goes to 3, that goes to 9. It makes this pretty looking, flowery looking thing, and the cell just dissolves whenever it's made. You got 60 billion, don't worry about it. And by the way, when you hit 30 years old, you're going to lose 2% of this anyway. But what if you lose 3% or 4%? Do you know what that adds up to? You being demented when you're 51, not 81. That's 30 years of you being completely alive but functionless. Now, by the year 2025, it will cost more money to treat that one disease than we have in the entire federal budget from taxes. So now what do you think is going to happen? They're going to cut home health. You're going to be taking care of your dad, or you're going to be taking care of your mother. Or what if you have nobody to take care of you? I'm being serious. That's why I had girls. If you got boys, you're screwed, man. They're going to be like, put dad in a nursing home. Girls will be like, oh, let's at least give him a bath, okay? You guys know it's true, okay? But listen, you get amyloid, you get blood-brain barrier breakdown, you get Lewy bodies, you get, in other words, when you lose energy, you develop, it's the cornerstone. When you get calcium influx, it is, there's a great paper called Calcium Buffering Systems, the cornerstone of all neurodegenerative diseases. Everything I'm telling you right now comes right out of a paper, and it was made by somebody who didn't even know that we were looking at things like this. They just did research on the homeostatic control of intracellular calcium. By the way, your serum calcium has nothing to do with it. You can't measure it. Now, I'm trying to talk to some SpectraCell people to see if they can show me a way to do it. Look at this. The nucleus starts to break down. Now we lose the production of proteins. And when we lose the production of proteins, now we lose structure. We lose transporters for neurotransmitters. We lose the intracellular messengers. We get cytokine production. And guess what? Your innate function goes away. This is called, what's it called? Innate intelligence. Wait a minute. There's a scientific explanation for innate intelligence. I mean, if I adjust you, and I activate AMPA receptors, and I activate NMDA receptors, and I have good calcium responses, and I make good energy, and I make good proteins, and these good proteins make good surface receptors, and I have everything there where I can make plasticity, and now I'm replicating things where they're not duplicated and deleted. If I'm doing this, you mean I have better innate intelligence? The answer is yes, ladies and gentlemen, you do. And that is not a Brockism. That's from the literature. Damn, they were right again. They just didn't know what they were talking about. Their vernacular was not up to date. It's like if you went back 1,000 years ago, and if somebody could have a vision of a helicopter, they would say it looks like a dragonfly. They don't know. These guys were just explaining what they knew. They knew this, that when people were activated and were healthy and had better brain function, that things just didn't fall apart as fast. My kids will always walk up to me when they're sick and they're like, will you just adjust me? I don't know why. I wasn't one of those chiropractic dads that said, you have to get adjusted every day, kids. But they walk up to me and they're like, will you just adjust me? I'm like, sure, let's go. I don't know why. They just gravitated towards it. But if we don't have this, we get things like inducible nitric oxides, which, by the way, you can completely shut down with vinpocetine. We get things like caspases and superoxide anions, which, by the way, you can shut down completely with glutathione. We get things like free radicals, which you can shut down with alpha-lipoic acid, glutathione.
superoxide dismutase. In other words, I'm telling you this, guys. We have mapped out every one of these pathways and found nutrients from the literature to block every one. Every one. So now you tell me if we've done something that will help slow neurodegeneration from a supplemental nutraceutical perspective. The answer is yes. So, does nutrition matter? And I'm going to tell you unequivocally, beyond a shadow of a doubt, abso-freaking-lutely. I got patients that I dose before treatment, after treatment, during treatment, so they can have the energy and capacity to do treatment. Because that same nutrient, vinpocetine, also upregulates NNOS and ENOS, which means I vasodilate and perfuse my tissues. And if you're hypoxic, guess what happens? If you're hypoxic, tissues die quickly, they escape, they croak, and you can't handle therapy. I want you to handle an hour's worth of therapy. We have people that come in. I had a lady, she was about 62 years old, good friend. I've been treating her and her daughter for years. She had a head injury. She came in, I did some vestibular work on her. She was in bed for 3 weeks. Good job, Dr. Brock. Good job. You almost killed her. Way to go. Exceeded her metabolic rate like that. Well, guess what? She has phospholipid antibodies. She became inflamed. By the way, phospholipid antibodies will cause massive vasospasms. She almost had 3 strokes. Every night, my sphincter was so tight, I was like this. Please don't have a stroke, God dang it, please. I mean, it was an autoimmune situation that was perpetuated by this bad brain, and when the brain exceeded its rate, it got worse, and literally I kept her alive with nitric balance. I was thinking, baby Jesus, 7 pound, 6 ounce version. I was like, thank you so much for letting me understand this one product, because I'm pretty sure it kept her going. So when you do this, you make plasticity, and all of these little cell bodies, they end up connecting together. And when they end up connecting together, one Brodmann area functions well enough to connect to another Brodmann area. And now we get something that looks a little bit like what I'm fixing to show. And that is this. Why does it matter? Who gives a crap? Just live your life. If the what happens, medicate it. Don't worry about the why. The only problem is, if you leave the why, it'll just cause another what, which means you'll take a medication for that what. And I can tell you, I know what I'm talking about because I've medicated those whats. I've practiced in the system. I told you, I didn't take the school's word for it. I'm way too cynical. I went out and learned. I'm like, I got to learn the hard way, the easy way, and I learned the beauty of medicine. It made me a much better practitioner because I got to see people at a level where they had lost almost all their humility and humanity, and they were totally dependent on somebody who was either going to be a jackass or be nice to them. When you're sitting there naked with a broken hip and you've crapped on yourself and you're disoriented, you see a human at their absolute most vulnerable. And it impacts you to the point to where you're no longer the same doctor that you were previously. You don't get that experience in chiropractic. I had a guy in hospice that was a Vietnam vet, and he had his legs blown off, and so he came home and he would do heroin, and he would do heroin so bad he would pass out for 3 days, and he got decubitus ulcers so bad on his butt that you could see his intestines through his sacrum. And literally he was catheterized with a permacath, and these they go in and you fill the outside rim up with water so it won't come out. He rolled around in a circle, and it had gone in and out so much that it kind of formed scar tissue. The bulb pulled out his penis trifurcated like an overcooked hot dog. When I got there, the nurses, because I was a chiropractor, they thought it would be funny to send me in there. When I went in, he grabbed me and he told me to kill him. And I got to be honest with you, for about 3 seconds, it actually crossed my mind. I was like, you need to die. Listen, you look at me like I'm crazy till you're there. And then you say to yourself, this dude might be better off not here. Every new person that he comes in contact with, he asks, just in case they'll do it. I came back out and I was like, that's pretty funny. I said, he actually opened up to me. He thinks y'all are assholes.
elongate out the word. He thinks y'all are bad folks. You know why? Because he knows you're making fun of him. Guess what? I learned right then and there that people are people. It hit me, and it's never changed. It's never changed. But neuronal integration, the principles of plasticity. We do these receptor-based activations, and we activate this, and we look at it and say, do you have cerebral blood flow? That's why I like to do a lipid panel. That's why I like CRPs. That's why I like homocysteine. Hey, if your homocysteine's over 13 and you're not getting it fixed, just get ready for your stroke or heart attack. You could take some methylated B vitamins and get it down to 7 and probably live 20 years longer and never worry about it. So just say nutrition isn't any good, but when you're in the cath lab and somebody's drilling a hole next to your nutsack so they can get up to your heart, just think about me. Because that's what they're going to be doing if you leave your homocysteine up that high. Okay? And by the way, your brain is going to be suffering. Well, the inflammatory mechanism, phospholipid morphology, that's all those essential fatty acids. Oxidative phosphorylation, that's our mitochondrial function. Methylation capacity, and fuel issues. These guys all come in and they say this. If I give you an adjustment and all of these principles are correct, we have the possibility of making plasticity. You have the possibility of making a frontal lobe again, if that's what you're aiming to do. You have the possibility of making a cerebellum again, if that's what you want to do. In other words, if you're a good functional neurologist and you get all these things in order, the principles of plasticity become more graspable. My wife's an English teacher. I always throw in a couple of words that are not real words just so she can smack me around later. I like that. So you're like this, okay, why would I adjust you? All primary afferents go to the cerebellum. Well, the cerebellum goes to the vestibular apparatus, and it goes to the pons, and it controls this, your posture, your coordination, and all your vital centers, and it integrates your autonomics. It's pretty important. So now when you can't do a finger to nose, and you don't have any more barygmas or bowel sounds, you can start to sit there and say, hey, wait a minute, you got gut problems, but I think this gut problem might be part of your brain. So now we're figuring out ways to say, do you have a primary gut problem or a primary brain problem? Do you know how important that is? That will keep you from running $10,000 worth of tests. And you just say this, let's go fix this person's brain and watch their ulcerative colitis change. Or, we can fix their brains all day long, it's not going to do anything. They have ulcerative colitis because of some other reason. Let's go fix that. You're like, Dr. Brock, you're not a chiropractor anymore. You're right, I'm not. I have 2 degrees. I did that on purpose. Because I told you not one thing answers everything. I told you that. It's okay to say that. Oh, what about all of these segmental reflexes? Those are called subluxations. Those are called cross-chord responses. Those are called, my hamstring has too much tone in it, which means my other side quadricep may have too much tone in it, and I may have rotation, I may drop an arch, I may get internal screw-home mechanisms off, and now I get some other posturally mediated reflexes that aren't right, so I get this, AC joint problems, stress on my supraspinatus, my AC joint subluxates, and now my gait is altered, and when your frontal lobe goes, you can't dual task, so you see this. And then you see their frontal lobe go and you see this. And then you see their basal ganglia go and you see this. Well, then the cerebellum goes off to this brainstem like I've been talking about, and your brainstem activates your P450 system. Hello, detoxification. Right out of a paper. I did not make this up. It didn't say this, an adjustment went there. What it says is this, the brainstem through the vagal apparatus comes down and activates your P450 system. It activates all your postural segmental reflexes. So listen, can you look at somebody and say, look, they got posture changes, and say, I wonder what their P450 system's doing. And then you look at them and they're like on 7 medications, and you run a genotox test on them and they don't metabolize any of them. And now their brain's getting worse and worse and worse because they're getting hepatic encephalopathy. Whoa, that's not chiropractic. Well, yeah, it is, if these are the regions that control segmental reflexes. If it's the region that controls segmental reflexes, by definition of everybody, it's chiropractic. Okay? Whoa, autonomic control like heart rate, perfusion, sweat, all of those cool things, respiration rate. Oh my goodness. All of these things contribute towards, can we handle the toxic load? Do we recycle glutathione? Do our barriers break down? Do we become toxic? All from receptor-based activation in the right environment, through the right systems, into the brainstem for vital functions. And by the way, posture is a vital function. Posture is a vital function. Just like your pulse, just like your blood pressure, it's in this. It's all cooked in the same bowl of stew called the brainstem. All these nuclei live next to each other, and when you have bad posture, I can guarantee you there's going to be autonomic fluctuation. Not system. Okay. Whoa, heart rate, gut function, blood flow, the splenic active, your spleen's a giant node. We're like, it's the biggest rave in the world for white blood cells. It's like, it's a giant rave of naive. Jerome, mix me some music, dude, come on. This is where you're cued. This is where all of the naive T cell, white blood cells live, and like tons of red blood cells, and everything integrates into there, and all the information is exchanged and all this stuff. This is when you get things like mono, like your spleen gets bigger. I'm a macrophage. I'm coming in. I'm like, hey, everybody, and like, you're full of debris, and you walk up to a naive T cell and you go, here you go, and you give it to him, and the T cell says, oh hell no, no way, and it turns into a Th1 cell or a Th2 cell. And then it goes out and it turns into a monocyte, which turns into a macrophage when it gets into the tissue, and it starts eating whatever it is. Hey, if the brainstem breaks down and the vagal system breaks down, you don't do that. Oh, and all of your intracranial autonomics are vagally mediated, and that's why they're doing this. Wrapping wires around vagal nerves and doing vagal nerve stimulators, and people with pain are getting better. Period. End of story. We do it differently, but there's ways to do it. Okay? Pretty cool. Are you guys seeing what an adjustment does so far? Am I opening your eyes a little bit? That's all I wanted to do. Okay, so look. We come over here, it inhibits pain. It's that simple. The brainstem causes descending serotonergic, enkephalin or opioid-based, and noradrenergic systems that inhibit wide dynamic range neurons in the back of your spinal cord. So the little volume knob on pain turns up or down. That's what this is. My shoulder hurts. And you become deafferentated. Now my shoulder, chest, all the way over here hurts. It's called this, a freaking trigger point. I wish I had 3 hours to talk about it. My wonderful wife over here. Say hi, baby. She was supposed to have shoulder surgery. I got some dextrose. Got some bicarb, turned the pH to 7, gave you about, 50 injections around your shoulder. The sugar made it grow back very, very quickly. Activated the receptor. So, catch me. Natural killer cells are mediated by your cerebellum. Natural killer cells are like the Navy SEALs of your immune system. They don't really have a boss unless the skipper comes off the boat. They just sort of walk on the base. They do what they want. Nobody really knows what controls them. It is literally an innate function. Oh, ye of bad posture and bad vestibular system, just look at the natural killer cell count change. Man, if you want to get a viral infection that never goes away, just lose your natural killer count. I love it. Now, your right brain does this. It stops immune function and cortisol overactivation. Your left brain drives up your immune system. So people who are immunodeficiency, they have left brain deficiency. Or
They have, you know, a right brain that is doing something, you know, opposite of that to allow it to occur differently. We are now treating people with functional neurology, not even off of functional neurology tests, just off their labs. Now that makes a lot of people angry. But when your TG antibodies and TPO antibodies go down to nothing after 14 days, like they did today on a patient that was leaving to go back to Australia, and she now has tachycardia because the thyroid medication we put her on is now too powerful, I have to sit back and wonder, what did we just do to her immune system? What if, just what if, we changed it to the point to where that medication is now not needed for the moment? That'd be something. It's a cool question to ask, isn't it? Well, that immune system modulates B and T cell natural killer cells, the cerebellar component. So it modulates B and T cells, your Th1, your Th2 expression. Are you going to be overinflamed? Are you going to produce antibodies against everything? And natural killer cells. It modulates cytokine secretion by the thalamus and the bone marrow. Wait a minute, so Dr. Brock, let me get this straight. You're telling me that adjustments modulate B and T cells? Yeah, kind of. I mean, hypothetically, possibly, whatever I can say that's not absolute. Thymocyte maturation, of course this is to a certain age when your thymus doesn't atrophy. And then of course the cerebellum fires to the contralateral cortex. So now we've climbed all the way up to the brain. Now we've got the frontal lobes, the temporal lobes, all of these parietal lobes. We've got all these different regions. And now the cortex does things like, well, it changes language and behavior and intellect and movement and sensory integration and spatial senses and cognition. So wait a minute. Where does PTSD live? Does anybody really know? It lives in your right orbital frontal lobe. When you have a crappy cortex, you cannot make sense out of your limbic system. It's that simple, man. You'll perseverate over something. I saw that kid get blown up. I can't get it out of my head. My dog. Somebody shot my dog. I'm not letting it go. You wouldn't even believe me if I told you the way we dealt with it. We taught them how to perseverate positive thoughts, coupled with vestibular therapy, coupled with olfaction. And now whenever they walk outside, they go, and they smell it, whatever it is we gave them, and now they perseverate over their positive thoughts, and they can walk in the grocery store. Olfaction, very, very, very entorhinal cortex, powerful summation over the limbic system, which curls right back around and goes right into the dorsolateral frontal system, and then goes into the thalamic relays after that, not primarily, but secondarily, and causes major changes in all of your pituitary output, hormone output, and endocrine system as well. Fascinating. So look, we did this. Then we realized this is the right brain slowing and it gives you prosody. If you don't have it, you have prosody, or you're like, it's that college professor you had that I picked, and she's like this. We are going to study ANOVA statistical calculations today. And you're like, listen, your IQ is in your left brain. Your creativity is in your right brain. Language is left, but the ability to say, woo-hoo, let's go have some fun, that's in your right brain. So now you get this person that's got a gigantic left brain, and they marry another person that has a gigantic left brain. You know what they have? An autistic kid. Because they have super gigantic left brains. I'm not kidding you. It never fails. I see it all the time. I see a super duper smart person married to another super duper smart person. You're like, this is why I would tell people, man, don't let your first wife have the same hemisphericity as you. Because here's why. You want to have kids. So you want you to have a good right brain because you're going to be big
take left brain, they have a better vocabulary than you. The two will come together and you'll have a perfectly balanced child. Whenever y'all have nothing in common, marry somebody that has the same hemisphericity as you, because then you'll both like to go have fun. Come on, you guys. Telling y'all how to pick mates here. So the left brain enhances, it gives you IQ. We know that the left brain goes to the right side of the body, the right side, or the brain goes to the left side of the body. So look, this is a paradigm. And the paradigm is this. If your paradigm's not changing or shifting or evolving, your paradigm sucks. It does. If you're still using antiquated words from dudes that didn't know the words or they would have used them anyway, I'm telling you right now, they would have used those words that were real. They made up words that were pretty close. But if you're still reading books and you're still repeating those things as if they're mantras, and you're not just replace the freaking words with the right words, and then the rest of the world will say, okay, at least they're using the right scientific terms. Maybe now we can actually all talk to them and not think that they're crazy. It's hard. Listen, I'm a little too blunt sometimes, especially on Friday night. Is it not true? You don't have to lose your philosophy. You don't. You do not have to lose your philosophy. By the way, when you activate a brain, we know that it makes it healthier, and you survive better, and you don't get infectious diseases easy, and you don't get autoimmune diseases easy, and you do better. We know this. It's a lot better coming from somebody when they use words that have been invented between now and 1960. It's the truth, man. So I just want to say this. Let the philosophy evolve into what it is. It's got plenty of science behind it. Don't ignore it just because you think the people that made it hate you. Use what they did. Use what they did. Go pull their research and let them do it for you. I don't want to sit around and research one thing for 15 years so that some punk can use it. And look, just like I always say, I know that a spoon is the best thing to eat soup with. I do not have to research that. But somebody had to sit down and figure it out. The perfect curve, the right angle, the shape, and all that stuff. Somebody had to sit down and figure it out. I just like this. Give me something that's domed, and I can just flip around and or I'll just pick the bowl up and drink it a different way. Okay? This, ladies and gentlemen, is a paradigm shift. It's probably not even a legal paradigm shift. I'm not telling you that you should comply to this. I'm telling you this. This is a paradigm shift involves a thought process, and a thought process then has to be researched, and the research and the thought process has to be proven, and then you can sit down and say, okay, maybe we should start applying this in certain instances. Hey, should chiropractic care be the primary cancer treatment choice? Not right now, no. But should it be used as an ancillary tool? Yeah, maybe. Maybe. What about autoimmune disease? Maybe. You go ask the old timers, they've treated all of them. I'm telling you right now. They have. They've literally been tarred and feathered for it. I'm not kidding you. Tarred and feathered. That's not a joke. My thing is this, I wanted to have so many things under my belt that to take my credibility away would be tough. So that when you say you're just a dumb chiropractor, I'm like, no, I'm not just a dumb chiropractor. First of all, I'm a chiropractor and I'm not dumb. Second of all, I went to some other places and learned what? That I really am not a dumb chiropractor because I learned more in chiropractic school than I did there. I learned more about labs in chiropractic college than I did in nurse practitioner school. I have zero problem saying it. So, look. What are you waiting on? Seriously, what are you waiting on? What are you waiting on? Are you waiting on anything? How old are some of you guys? Like 19? That's good. Look. Learn. Do what you got to do to get through school. Don't say Dr. Brock said this, that, and the other and battle your professors. I like your professors. I don't want to fight with them. But I'm telling you right now, I don't live inside the gates on Walnut Hill. Okay? I live in a clinic where the worst of the worst of the worst shows up. Am I right, guys? It's like we walk in every day and we're like, well, what's going to walk in today? And we just look out the hallway and people are like, okay, just I mean, it's not, I mean, and that's not to make fun of people, it's the truth. No, some of them don't walk in. And so we have to do this. We have to say, what are we capable of doing? What can we do to make things better? And how are we going to take our paradigm and shift it? There's no better place to shift a paradigm than there because we're forced. We're forced. Because, let me go back to what I said earlier. Doctor, I have no hope. Doctor, I want to die if you can't help me. Doctor, I don't care how much money it costs. Doctor, I heard you knew something that some other people don't. Somehow, some way, you end up making it on the radio or on the news, and now people think you're something that you better be. If not, it's going to be a long day at work. 110%, man. That's what a famous Navy SEAL, Marcus Luttrell, told me when he came in and got treated and started this whole thing. As a referral from the governor of Texas to me, a Parker guy. He graduated in the middle. I was not the valedictorian by any stretch of the imagination. But I've never been scared to say this. What are we going to do? Let's do something. Let's think. Let's be critical. Let's get a little radical. Let's do something that nobody else is doing. Let's break the rules, not break the law. I said it. Let's break the rules. Let's not break the law. What I'm saying is, let's take the rules of the philosophy of all of our forefathers and challenge it and add to it and make it grow. It doesn't matter who your forefather may be. It may be BB. DD. It could be BB too. Who the hell ever knows that is, right? It could be any of those guys. But you're going to challenge them. You're going to say this, look, man, that person taught me something for a reason. Maybe I can add on to it. I tell my wife. My wife asked me, what do you want? I'm like, I just want to be able to teach a bunch of people stuff so that they can then learn what I learn in like half the amount of time, step on my shoulder, jump off, and catapult forward and keep going. That's it. I'm merely a brick in a garden that somebody's stepping on so they can get to the other side. So maybe are you. You're the next generation. That's why I asked you, how old are you, like 19? Because you got time. See, you don't grow these flowers overnight. When you're about 25 years into it, you can say, maybe I have enough something to contribute to something, to make something, so that somebody else can take that something and make it more. And when you do that, maybe that's why you're sitting in Neuro Club on a Friday night. I don't know. I know this. There's more to it than you think. It's been watered down to the point to where it's silly, and you know it. So do I. People still play the game. Still teaching stuff that's unbelievable. But that's okay. Because you're going to take it a step further. If you don't, the legislation will never change. The scope will never change. People are coming after us. They don't want you doing any of this stuff. It does scare them. And it scares them for legitimate reasons and non-legitimate reasons. It is as violent, meaning vicious, as you've ever imagined. And it is true, the medical profession at its association sources really don't like this group of folks too much. I'm not going to overstate it and say they hate, because I think it's probably bad taste, but they really don't want to see you thinking this. This is contraband. Unfortunately, I pulled it out of papers. It's not even my idea. So it's a little after 8:30. And I know you guys don't want to be here all night. I've said plenty. I don't expect you to learn all of functional neurology or all of functional medicine or all of chiropractic in one night. I always say when I come to these things, I'm very thankful that the people from Neuro Club invite me. They have a choice to invite whoever they want to speak. I'm very, very grateful that I get a chance to be around great people. I consider y'all the greatest people because you're students that are sitting here and you're not working, you're getting student loans, you're having to pay through the rear, and all you want to do is learn. And I like it. I do. I think it's cool. I was there. I remember hating it because I thought God, I'm going to be in debt until I'm dead. I paid off my student loans. You will too. You'll have to work your rear off. I did too. The last 2 years, I've worked an average of 70 hours a week. It's pretty cool, except for being tired and old with no hair. But I did get a hair cream out of it and a hot wife. Now, does anybody have any questions? Oh, shoot. What do you got, Jerome? Yeah, look, we got a couple things coming up this year, and I don't know that I'm supposed to say this really on Parker campus or not.
That's cool. It's like, I'll take a E for it. Go ahead.
Okay, I'll take a E for it too.
Can I preface that with something?
Yeah.
And this is so you guys understand the magnitude of this. I was at Life University for a year. Sorry, Dr. Jerome. I was there for a year. I heard, this hurts a little bit. I left after a year of life because I heard Dr. Brock speak. And I was like, I gotta be closer to Dallas. I heard there's a chiropractic school there. I'm gonna go learn this as much as I can because I can't afford to go back and forth and back and forth. I just want to be around this guy because I respect what he knows, right? So you guys are about to have the opportunity starting in February, especially if you're a member of the neurology club. If you want to get the hours and pay for it for that stuff, that's great. But you're gonna have, if you're a member and you come, you're gonna be able to get this every other month, right? For free.
It's free.
So what he's about to say isn't, and I prefaced the
That
free
is the
part
dumbest damn thing
because
in the world
it's not making money, but it should be a common sense thing to me. Is if you're going to get a doctorate degree in chiropractic, you should probably know what's on this diagram. And everything on there isn't to make it better, to make it worse. It affects this. So you should probably know what affects it in a good way, what affects it in a bad way. What biomarkers do we have to check pre and post if we're doing something right? Because we have that moral obligation to make people better, right? So this is something that we should all, I mean, we're here on a Friday night because we like it. So what he's about to say, I'll take the heat for it, that's fine.
Okay, well then I'll just say this. We're going to stream it live. If you want the hours for it to become a diplomate, it's $100 a class. If you don't want a diplomate, I would have neutered myself for that option. When I started the neurodiplomatic program in Tri-7, it was all I could think about. I have a perfect score on one test my whole life, and that was my neuro boards. I was like, nothing's taking this from me. It made sense. It was where it led me on my journey, just beginning. I'm getting ready to submit the continuation of this project at an IRB at Duke University. All my instructors think I am nuts. I'm pretty sure. But hey, guess what, man? We're doing another program. Me and Aaron Van Volheisen, we're starting a functional medicine program that is also going to be streamed online. That's not as cheap. That wasn't my decision. But guys, you got programs coming out. There's no reason why you can't learn. They're not on the same weekends. They don't conflict.
For those of you guys who don't know me, I'm the one that's the punching bag during this.
Jerome is a fantastic functional neurologist, ladies and gentlemen, that I work very close with, and then Dr. Ross Solis. Give them both a hand. Yes. I will say this, both of them, that they're, I mean, I'm up here getting to talk and all this stuff. I get way too much credit. These guys are rock stars, so.
Appreciate it. Eases the pain a little bit.
Don't worry, man, I got testosterone on the car.
How many of you guys have taken a module from the Care Institute so far? Okay, so a couple of people. Okay, so it's safe to say that none of you, the rest of you guys have taken a module. Let me put it in perspective for you, because I know finances are a big deal. I actually went to school for neurology and took my first diplomate class in pre-DC before I entered into it. My story's a little different. I can tell you about it later. But by the time I graduated, I took 1,500 hours. The courses are $32 per hour with the Care Institute. Okay, so if anybody wants to do the math on that, that's what I did while I was in school. Okay, and it's definitively made every difference to what I do now.
Yeah. There's been a day in my life in the last 14 years where neurology has not played a part in it.
So, and I say this to say, funny enough, and I give Jason a hard time, he moved out to Texas, and I ended up following him to Texas.
Love.
Yeah.
Love.
Just
Exciting and new. Come aboard.
come eyes, ladies, right?
I just think that Jerome can really sing.
Yeah. For what it's worth, I have an unbelievably smoking hot wife, so.
I actually made him reinforce his sexuality around
This is what happens at 9 o'clock on Friday night. This is the point that I make. I'm not telling you guys not to do one versus the other. I'm saying if you're going to do anything, sometimes the difficulty with making the decision is that there is a financial burden that you guys have while you do this.
I'm telling you to do one versus the other. No, hey, but I will tell you this. We're doing it in San Diego live.
Yeah, and it's,
The student, we only put 40 chairs in there for students at $100, and it sold out in, I don't know, an hour and a half.
yeah.
So there's only streaming left. But why would you want to buy a plane ticket to San Diego when you can just sit here and watch it anyway? I mean, it's go get you a cooler of, Bartles and James. Huh? I don't know exactly how it's all going to go down yet as far as watching it. Layla's we have people that are going to be helping out.